Hello everybody. Today we will discuss oral, topical and rectal medications. This procedure is prepared by Marwa Abdelmejid Abdurrahman Khalil, Assistant Lecturer at Pediatric Nursing Department, Faculty of Nursing, Cairo University. Let's start with oral medication. The following guidelines are very important to be considered when you administer oral medication for children. These guidelines are: use the oral route whenever possible because it is the least invasive method and less traumatic than intramuscular and intravenous routes. Medications are administered within 1 hour of prescribed time, not more than this. Administer oral medication in a manner consistent with the child's age and developmental abilities. Up to 3 to 4 months of age, liquid medication may be put in a nipple or oral syringe. The rooting and sucking reflex stimulates the infant to suck the medication and swallow it. From 5 to 11 months of age, put liquid medication in an oral syringe and administer in small amounts towards the side of the mouth, not towards the throat. Assess the child's previous experience with oral medication. In case of mother presence, involve her in child positioning. It is preferable to give medicine while the child is in her lap. Provide therapeutic play as indicated. Assess for drug allergies if present. Notify the healthcare prescriber. Medication should be taken before, with, or after meals as prescribed, and you must teach the family how to administer oral medication. Let's go to topical medication. Medications are given topically through the skin and absorbed because of skin relatively rich in blood supply. Children have larger body surface area and thinner layer of subcutaneous tissue than adults, so there is an increased risk for systemic absorption and effects through topical application. Don't apply topical medication to skin with open lesions until ordered. Medications are administered within 1 hour of prescribed time. Assess a child's previous experience of topical medication and assess the child's skin integrity and noting area of healing, edema, rashes, or redness. Assess for drug allergies if present. Notify healthcare prescriber and apply identification band indicating allergies. Teach the child as appropriate to cognitive level and family about the medication's action, side effects, and how the medication is to be applied. Now, let's go to rectal medications. What are indications for use rectal route? The rectal route may be the best choice for a child who can't tolerate oral medication and in whom parenteral route is not available. It is administered when the oral route is not acceptable or when a local effect on the bowel is required. You must note that the rectal route is not the preferred route because of potential emotional trauma to the child and unpredictable absorption from the colon. Absorption can be further affected by the presence of stool in the colon and rectum. Rectal medication administration is contraindicated in children who are immunosuppressed or thrombocytopenic because of the risk of infection or bleeding. There are two types of rectal medications, suppositories and enema. Suppositories are stimulant suppositories, stimulate bowel activity, soften stool, for example glycerin and sodium bicarbonate, or a retention suppositories which deliver medications, for example paracetamol.
Everybody, I am Dr. Marwa Abdelmegid, Assistant Lecturer at Pediatric Nursing Department, Faculty of Nursing, Cairo University. Today we will discuss 3 types of medication administration routes, oral medications, rectal medications, and topical medications. Let's start with oral medication. Now we will discuss which equipment I need to do oral medication. Number 1, I need the prescribed medication, any type of medication, non-sterile gloves, and oral syringe or medicine cup. Okay? Let's start the procedure now. Number 1, let's start the procedure. Number 1, wash hands to reduce transmission of microorganisms. Strict hand washing is the most important principle before doing any procedure. Number 2, prepare all needed equipment in order to save the time and effort. Number 3, check the 10 rights of and then Number 6, hold an infant or a small child and elevate his head. Okay? Upright position aids swallowing and help preventing choking and aspiration. Placing the syringe to the side of the mouth. Okay? Number 7, placing the syringe to the side of the mouth to prevent gagging and choking of medication. And then, number 8, administer the medication. For infant, deliver liquid in small amounts and allow infant to swallow between amounts. And allow time. Okay? For older child, based on developmental age and abilities, give child the medication and allow to self-administer. Number 9, stay with the child until the medication is swallowed to ensure that the child has received the medication. 10, dispose of medicine cup, syringe, and other objects. Okay? And 11, remove your gloves to reduce transmission of microorganisms, and then wash hands, and then you must record time, dose, and amount of medication and report about any abnormalities. Okay? Let's move to topical medication. Right, it is very important. And number 1, prescribed medication, okay, non-sterile gloves, clean towel, basin of warm water, okay, gauze if needed, sterile dressing if needed, and appropriate applicator, cotton swab, tongue depressor, or others. Procedure. Number 1, wash hands to reduce transmission of microorganisms. Prepare all needed equipment. Check the 10 rights of medication to avoid medication errors. Wear gloves. Okay, and then clean the skin before application of medication using warm water and clean towel. If an open wound is present, use sterile gauze instead of washcloths, and this for clean the old medication of the skin. Okay, clean towel and warm water, and then clean the skin. Okay, then dry skin well after washing with clean towel or gauze based on skin condition. You must dry before applying the medication. And then apply ointment, gel and pastes to the site using cotton swab or long blade by correct amount and techniques, or nurse's gloved hands. I will use tongue depressor and I will put the amount of prescribed medication and then apply the medication with the correct amount and distribute it on the skin. Okay? Okay. If powder or spraying ordered, sprinkle it to the side and turn the child's head away. If patches are ordered, apply them to flat area of skin and rotate the application side. In powder, you must to avoid inhalation of medications that may cause lung tissue damage, and flat areas help the medication remain in contact with the skin. Number 8, apply dressing over the site if indicated. If not indicated, you cannot apply dressing as ordered or based on a hospital policy and physician order. And then remove gloves and washing hands to reduce transmission of microorganisms, and then record the time and dose and amount of medication, and then report if any abnormalities is present to communicate the abnormality for healthcare team, and then return the medications to appropriate storage area to provide safe storage of. Now let's go to rectal medications. Equipment, we need the prescribed medication. Okay, we have a suppository. Also we need water soluble lubricant and non-sterile gloves. Okay, let's start the procedure now. Number 1, wash your hands to reduce the potential transfer of microorganisms, and then prepare all needed equipment to save your time and effort. Check the 10 rights of medication administration to avoid medication errors, and position the child in a left lateral position with the right leg flexed or in the knee chest position. According to developmental stage of the child, either of these positions expose the anus and helps relax the external sphincter for ease insertion. Okay? You must now expose okay, and then ask the child to take slow deep breaths if possible according to the child age to relax the anal sphincter. And now you must visualize the pre-anal area, okay, to assess for any abnormalities before inserting suppository. Number 8, remove the suppository packaging. remove the suppository packaging and lubricate the apex of the suppository with lubricating gel. Okay? And then insert the suppository apex first into the child's rectum, just past the internal sphincter to prevent injury of soft tissues. Okay? We'll insert the suppository into the anal canal and then gently hold the buttock for 5 to 10 minutes if possible to reduce pressure on the anal sphincter and also risk of expiring medication. And then clean away any lubricating jelly with gauze. Okay? Then dispose of equipment appropriately and dispose all equipment appropriately, okay? And wash your hands and reassure and brace the child and record the medication administration, record the time, route of administration, and report of any abnormalities if present. Report about skin color, bleeding, skin hematoma, and edema.